Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
After surgery for an ileal conduit, the nurse should closely assess the client for the occurrence of which of the following complications related to pelvic surgery? 1. Peritonitis. 2. Thrombophlebitis. 3. Husitis. 4. Inguinal hernia. The correct answer is 2. Thrombophlebitis. After pelvic surgery, there is an increased chance of thrombophlebitis owing to the pelvic manipulation that can interfere with circulation and promote venous stasis. Peritonitis is a potential complication of any abdominal surgery, not just pelvic surgery. Husitis is most frequently an indication of liver disease. Inguinal hernia may be caused by an increase in intra-abdominal pressure or a congenital weakness of the abdominal wall. Ventral hernia occurs at the site of a previous abdominal incision. If the client develops lower abdominal pain after a cystoscopy, the nurse should instruct the client to do which of the following? 1. Apply an ice pack to the pubic area. 2. Massage the abdomen gently. 3. Ambulate as much as possible. 4. Sit in a tub of warm water. The correct answer is 4. Sit in a tub of warm water. Lower abdominal pain after a cystoscopy is frequently caused by bladder spasms. Warm water can help relax muscles. Ice is not effective in relieving spasms. Massage and ambulation may increase bladder irritability.
The nurse is preparing to teach a patient with a new diagnosis of osteoporosis about strategies to prevent falls. Which teaching points should the nurse be sure to include? Select all that apply. 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. 4. Expect a few bumps and bruises when you go home. 5. Rest when you are tired. 6. Avoid consuming 3 or more alcoholic drinks per day. The correct answers are 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. And 5. Rest when you are tired. Rationale. The purpose of this teaching is to help the patient prevent falls. The hip protector can prevent hip fractures if the patient falls. Throw rugs and obstacles in the home increase the risk of falls. Patients who are tired are also more likely to fall. Exercise helps to strengthen muscles and improve coordination. Women should not consume more than 1 drink per day, and men should not consume more than 2 drinks per day.
A client is asking for information about using an intrauterine device. Which of the following questions asked by the nurse would provide pertinent information on whether or not a client is a candidate for an IUD? 1. Do you smoke? 2. Do you have hypertension? 3. How often do you have sex? 4. Are you in a monogamous relationship? The correct answer is 4. Are you in a monogamous relationship? Due to the increased risk of pelvic inflammatory disease, candidates for the IUD should be in a monogamous relationship. Smoking and hypertension are not contraindications for an IUD. The frequency of sexual relations will not affect IUD use. A female client with which condition would be at increased risk for vulvovaginal candidiasis? Select all that apply. 1. Uncontrolled diabetes. 2. Immunosuppression due to cancer. 3. Human immunodeficiency virus infection. 4. Hypertension. 5. Asthma. The correct answers are 1. Uncontrolled diabetes. 2. Immunosuppression due to cancer. And 3. Human immunodeficiency virus infection. Women with underlying medical conditions, such as uncontrolled diabetes, and HIV infection or cancer-causing immunosuppression, correlate with an increasing severity of candidiasis. Hypertension and asthma are not related to immunosuppression or complicated candidiasis. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client is prescribed oral metronidazole for treatment of bacterial vaginosis. What should the nurse instruct the client to avoid during treatment and for 24 hours thereafter? 1. Douching. 2. Sexual intercourse. 3. Hot tub baths. 4. Alcohol consumption. The correct answer is 4. Alcohol consumption. Metronidazole interacts with alcohol and can cause a serious disulfiram-type reaction with severe, prolonged vomiting. The client should not douche unless following a medical prescription, but douching does not interact with metronidazole. Sexual intercourse and hot tub baths are not known to affect the incidence or treatment of bacterial vaginosis. A nurse is reviewing a client's chart and notes the Papa-Nicolau smear laboratory report indicates visualization of clue cells and a vaginal pH of 3.8. What should the nurse teach this client? Select all that apply. 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. 3. All vaginal infections are sexually transmitted infections. 4. Do not douche unless instructed by a healthcare provider. 5. Usually vaginal infections can be treated with over-the-counter preparations. The correct answers are 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. And 4. Do not douche unless instructed by a healthcare provider. Bacterial vaginosis is a clinical syndrome resulting from the replacement of the normal vaginal lactobacillus species with overgrowth of anaerobic bacteria that cause a cluster of symptoms. Presence of a thick, white, adherent vaginal discharge with a fishy odor is evidence for bacterial vaginosis, and the client should seek treatment. The client should not douche unless under medical prescriptions because douching can cause bacteria to ascend into the uterus. Bacterial vaginosis is not sexually transmitted, and it does not require treatment of the partner. Vaginal infections commonly require an examination and diagnostic assessment. A client is scheduled to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. Which of the following indicates that the client understands how to manage the urine as a biohazard? The client will 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. 3. Clean the bathroom daily with disinfectant wipes. 4. Use a separate bathroom from the rest of the family for the next 8 weeks. The correct answer is 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. After intravesical chemotherapy, the client must treat the urine as a biohazard. This involves disinfecting the urine and the toilet with household bleach for 6 hours following a treatment. It is not necessary to use a bedpan and then empty the urine in the toilet. The client can use the toilet, but must disinfect the urine with bleach. The bathroom does not need to be cleaned daily with disinfectant wipes. The client does not need to use a separate bathroom as long as the client's urine is disinfected with bleach. The nurse is teaching the client with an ileal conduit how to prevent a urinary tract infection. Which of the following measures would be most effective? 1. Avoid people with respiratory tract infections. 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. 3. Use sterile technique to change the appliance. 4. Irrigate the stoma daily. The correct answer is 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. Maintaining a fluid intake of 2,000 to 3,000 milliliters per day is likely to be most effective in preventing urinary tract infection. A high fluid intake results in high urine output, which prevents urinary stasis and bacterial growth. Avoiding people with respiratory tract infections will not prevent urinary tract infections. Clean, not sterile, technique is used to change the appliance. An ileal conduit stoma is not irrigated. A female client who has a urinary diversion tells the nurse, "This urinary pouch is embarrassing. Everyone will know that I'm not normal. I don't see how I can go out in public anymore." The most appropriate nursing goal for this client is to 1. Manage her anxiety about her health. 2. Learn how to care for the urinary diversion. 3. Overcome feelings of worthlessness. 4. Express fears about the urinary diversion. The correct answer is 4. Express fears about the urinary diversion. It is normal for clients to express fears and concerns about the body changes associated with a urinary diversion. Allowing the client time to verbalize concerns in a supportive environment and suggesting that she discuss these concerns with people who have successfully adjusted to ostomy surgery can help her begin coping with these changes in a positive manner. Although the client may be anxious about the situation and may be feeling worthless, the underlying problem is a disturbance in body image. There are no data to indicate that the client does not know how to care for the urinary diversion. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is evaluating the discharge teaching for a client who has an allele conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. 1. If I limit my fluid intake, I will not have to empty my ostomy pouch as often. 2. I can place an aspirin tablet in my pouch to decrease odor. 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. 4. I must use a skin barrier to protect my skin from urine. 5. I should empty my ostomy pouch of urine when it is full. The correct answers are 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it, and 4. I must use a skin barrier to protect my skin from urine. The client with an ileal conduit must learn self-care activities related to care of the stoma and ostomy appliances. The client should be taught to increase fluid intake to about 3,000 milliliters per day and should not limit intake. Adequate fluid intake helps to flush mucus from the ileal conduit. The ostomy appliance should be changed approximately every 3 to 7 days and whenever a leak develops. A skin barrier is essential to protecting the skin from the irritation of the urine. Aspirin should not be used as a method of odor control because it can be an irritant to the stoma and lead to ulceration. The ostomy pouch should be emptied when it is 1/3 to 1/2 full to prevent the weight of the urine from pulling the appliance away from the skin. The nurse should teach the client with an ileal conduit to prevent urine leakage when changing the appliance by using which of the following procedures? 1. Insert a gauze wick into the stoma. 2. Close the opening temporarily with a cellophane seal. 3. Suction the stoma before changing the appliance. 4. Avoid oral fluids for several hours before changing the appliance. The correct answer is 1. Insert a gauze wick into the stoma. Inserting a gauze wick into the stoma helps prevent urine leakage when changing the appliance. The stoma should not be sealed or suctioned. Oral fluids do not need to be avoided. The nurse is assessing the urine of a client who has had an ileal conduit and notes that the urine is yellow with a moderate amount of mucus. Based on these data, the nurse should 1. Change the appliance bag. 2. Notify the physician. 3. Obtain a urine specimen for culture. 4. Encourage a high fluid intake. The correct answer is 4. Encourage a high fluid intake. Mucus is secreted by the intestinal segment used to create the conduit and is a normal occurrence. The client should be encouraged to maintain a large fluid intake to help flush the mucus out of the conduit. Because mucus in the urine is expected, it is not necessary to change the appliance bag or to notify the physician. The mucus is not an indication of an infection, so a urine culture is not necessary. A client who has been diagnosed with bladder cancer is scheduled for an ileal conduit. Preoperatively, the nurse reinforces the client's understanding of the surgical procedure by explaining that an ileal conduit 1. Is a temporary procedure that can be reversed later. 2. Diverts urine into the sigmoid colon, where it is expelled through the rectum. 3. Conveys urine from the ureters to a stoma opening on the abdomen. 4. Creates an opening in the bladder that allows urine to drain into an external pouch. The correct answer is 3. Conveys urine from the ureters to a stoma opening on the abdomen. An ileal conduit is a permanent urinary diversion in which a portion of the ileum is surgically resected and one end of the segment is closed. The ureters are surgically attached to this segment of the ileum and the open end of the ileum is brought to the skin surface on the abdomen to form the stoma. The client must wear a pouch to collect the urine that continually flows through the conduit. The bladder is removed during the surgical procedure, and the ileal conduit is not reversible. Diversion of urine to the sigmoid colon is called a ureterosigmoidostomy. An opening in the bladder that allows urine to drain externally is called a cystostomy. A client is to have a cystoscopy. Which of the following indicate that the client has developed a complication after the cystoscopy? 1. Dizziness. 2. Chills. 3. Pink-tinged urine. 4. Bladder spasms. The correct answer is 2. Chills. Chills could indicate the onset of acute infection that can progress to septic shock. Dizziness would not be an anticipated symptom after a cystoscopy. Pink-tinged urine and bladder spasms are common after cystoscopy. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanursiguide.com.